How Healthcare Changed in the Industrial Revolution by Paige, Elizabeth, and Lydia. During the Industrial Revolution, many people were living longer. This was mainly due to the lower death rate, improved nutrition from better farming techniques, and medical advances.
An important discovery during the Industrial Revolution was the link between microbes and disease. This was also known as the germ theory, which was the idea that diseases are caused by harmful microbes. Two influential people during this time were Robert Koch and Louis Pasteur. Robert Koch was a German doctor who identified the bacterium that causes tuberculosis. This helped him find the cure, but he found it 50 years later. Louis Pasteur was a French chemist who helped to prove the germ theory. He also developed vaccines for rabies and anthrax and discovered pasteurization. Pasteurization is the method used to get rid of harmful microbes in milk. Because of the discovery of the germ theorem, people started washing their hands and their clothes more, which helped to get rid of some disease. Improvements in surgery and hospitals. An important person who shaped the healthcare that we have today was Florence Nightingale. Florence was a nurse in a hospital who had personally experienced the poor sanitation and conditions in hospitals. More specifically, during the Crimean War, she was an army nurse and saw how bad sanitation was a problem that allowed for even more infection and disease among the patients. After identifying this, she realized improvements in hygiene were necessary to remove the stigma of hospitals being dangerous places. Many people who were wealthy would pay to receive care in their houses. For those who couldn't afford it, they were forced to come to the hospitals that weren't cleaned properly. Many people would end up getting sicker at hospitals from the germs, but they had no other choice. Once the germ theory was discovered, Florence spoke up for the patients in saying that hospitals should be cleaned regularly to do no harm to the sick. She was also known as the Lady of the Lamp because she would check in with patients throughout the night and was really popular and liked among the patients. Because of her compassion and professionalism, she made nursing a respectable career. This was different than before the Industrial Revolution because before the hospitals were bad, so nurses were perceived as bad. Once that changed, nursing became a good career option. Joseph Lister was a surgeon who used the germ theory to improve hospitals. Before the Industrial Revolution, it wasn't necessary or even common to wash hands before caring for a patient or performing surgery. Joseph Lister took the information about microbes causing disease and made sure that everyone in his hospital washed their hands and cleaned their instruments before performing surgery to reduce the risk of infection. This was important because a lot more people were surviving surgery.
As well as hospitals becoming more sterile, surgeons and doctors washed their hands more often. When anesthesia was introduced in the 1840s, better surgeries could be performed without any pain. Mutual Aid Society was created. Mutual Aid Society was a group created by workers to provide care for the sick or injured workers.
This was especially important during the Industrial Revolution because of all the new products that were being made. As all these products were being made, there were more injuries from the workers. The workers were unhappy with their health care, and so volunteers decided to form the societies to care for any injured workers.
During the Industrial Revolution, several discoveries were made that would improve people's health dramatically. The effects of microbes and germs were discovered, and people began to bathe and change their clothes much more often. Not only that, but surgery became safer and cleaner. Anesthesia made it possible for more risky procedures to be experimented with, and antiseptics were used to greatly reduce the risk of infection from surgery. These discoveries were able to prolong people's lifespans and cause the death rate to fall. Overall, people started to lead healthier lives and take many more precautions against disease.